In February of this year, as coronavirus began to spread across the globe, it became clear to us at SCOE this had the potential to develop into a pandemic, which would have tremendous impact on the way that we do business. Despite mixed messaging from the CDC, federal, state, and local governments, we took the initiative to preemptively take steps to protect our staff and patients and local community. We realized that although we are a specialty orthopedic group, and our purpose is not to be on the front lines taking care of COVID-19 patients, we are still critically important in the healthcare framework. We must continue to be able to treat patients with musculoskeletal disorders despite the pandemic, because if we were to close down, then the burden of treating those patients would fall on hospitals, ERs, urgent cares, and other healthcare facilities who need to focus their resources on patients with COVID-19 illness. Whereas many other specialty practices have closed down due to COVID-19, we wanted to ensure we were able to serve our communities. By the time the World Health Organization formally declared a global pandemic and the stay-at-home orders were issued in mid-March, we at SCOE were already prepared to remain open. In early March, we formed a COVID-19 safety committee to evaluate all aspects of the pandemic. This committee rapidly develops COVID-19 specific protocols, adapting our safety measures as guidelines change. Safety of our patients and staff is of the utmost importance as we fulfill our commitment to serve our community. SCOE was one of the first practices to install screening stations at all of our facilities and to screen for COVID-19 signs and symptoms and perform temperature checks on all employees, patients, and visitors. We also limited the number of visitors within our buildings to those who were absolutely necessary for patient care. This enabled us to more easily implement physical distancing protocols and guidelines. These measures are widely accepted as an effective defense against the spread of COVID-19. We were quick to implement physical distancing measures in all of our SCOE offices. We rearranged our facilities to accommodate the recommended 6 feet of separation between people. We leveraged technology and implemented telemedicine. We prepared to conduct patient visits through our own electronic medical record system. This enables patients to have virtual video consultations with our doctors directly through their smartphone from the comfort and safety of their own homes, which reduces the risk of exposure to patients and staff and supports physical distancing by cutting down on the number of people in our SCOE facilities. We realized early on that personal protective equipment and disinfectant supply shortages could become a reality, impacting our ability to serve our patients and community. To mitigate the risk, we created a COVID-19 supply chain committee to identify our changing needs and track our sources and supply chain to ensure that we were well prepared with all of our personal protection equipment and cleaning and disinfecting supplies. Having adequate supplies allowed us to be one of the first groups to require mandatory universal face masking within our facilities for all staff and patients. We continue to provide patients and visitors their own surgical face masks to wear upon arrival to our facilities. We also have adequate supplies of respirator face masks, face shields, gowns, gloves, and sneeze guards to maintain everyone's safety.
Sanitization is extremely important to keep our patients and our staff safe. In addition to our regular deep cleaning by our housekeeping staff, we routinely disinfect and sterilize high-contact surfaces, such as doorknobs, phones, and computers. Our utmost priority is our patient safety and our staff safety. Our staff understands the importance and is diligent about hand washing as well as hand sanitization. We have hand sanitizers throughout our SCOE facilities for our patient safety as well as our staff safety. In March, as coronavirus cases increased, all elective surgeries were postponed or eliminated. We gradually returned back to our elective procedures in April based on CDC, state, and local guidelines. Even so, we require preoperative COVID-19 testing for all our patients prior to any elective procedure for our patient safety as well as our staff safety. All staff wear masks and gloves. Our anesthesiologists wear N95 masks. Patient beds are spaced 6 feet apart, and patient selection as well as patient outcomes are closely monitored.
We have taken extraordinary efforts every step of the way to stay ahead of the curve. We have abided by CDC recommendations and additionally developed and instituted our own safety measures to make sure that patients and staff are safe and feel comfortable coming into our clinics. Despite many other healthcare facilities having healthcare workers and patients contract COVID-19 within their own walls, we at SCOE have yet to have a single incident of COVID-19 transmission due to exposure in our facilities. As new surveillance techniques and antibody testing advances are on the horizon, we are committed to developing new safety protocols to maximize the safety for our patients, staff, and community,